So Ritesh, brilliant point. And I was also curious about your other, I think, startup, which is Densys, which is got to do with dental care. I provided dental care for about 6 years in a previous life. So Arvind, I think you were spot on with the centralization and decentralization, accessibility versus delivery. But what do you think are the key challenges? You know, we've talked about why we need it, and I think there's nobody in this panel or in this room who doesn't think we need decentralization. But what do you think are the key challenges as a Polo hospital or as an individual who's been in healthcare for so long now? What are the key challenges in India for decentralization?
Mindset. When it comes to my health and I have the slightest irritation anywhere in my upper thoracic area, I expect the director of cardiothoracic surgeon to be physically present by my side holding my hand. All of us have this mindset. How much we accept it is different. So providing such a non-traditional form of a very traditional science leads to the issue of adoption. For a country like India, where there is regulation that is extremely weak on this subject, there is a clear or a high probability of malpractice or misguided, and also the possibility of delay of diagnosis that leads to a more complicated condition. So all of this is what leads to the slow adoption of decentralization and the traditional mentality of let's just go to the big hospital, to the big doctor and take care. Because that's what has been imbibed in our culture right from childhood. So we got to break that mindset and ensure that there is quality and there is reliability. When quality and reliability are reinforced, automatically the mindset starts accepting. And when we say that, because there is a need for it. So if I go to the quicker center, I'll get it faster and I have the assurance of quality. And that's what is going to get all of this going for us.
That's a very good point. You don't need a bazooka to hunt a fly. So you probably just need the right kind of treatment at the right price, right time. I think you're spot on that. But I want to go back to Ravi. Ravi, in your opening remarks, you had mentioned about the models. But we've I think discussed some of the challenges in our previous interactions. But what do you see as the big challenge from your perspective to decentralization?
I think a couple of things that I would possibly want to talk about. The first one, as he said, was basically quality. Quality, quality, quality. The task shifting is actually not happening today because people would possibly want to go to the tertiary care centers because they do not see adequate quality at the primary and the secondary care centers. Part of it is also because to do with the regulation part of it, in the sense that India does not have regulation in force which enforces quality at a grassroots level. You are willing to take those shortcuts and use equipments which can cause fatalities. Take, for example, the cases that happened with baby warmers in the north and in the east, where we have had several deaths because of inadequate quality and inadequate equipment being put to use. Quality is one thing that sort of hurts. The second thing is the financial viability that we need to look at, in the sense that how can we come up with financial models and partnerships which ensure that you spread the risk and at the same time get into a model which proves the financial viability in the long run. Otherwise, as we said, capital is scarce. One of the things that we really need to work on is to see what could be the possible business models in terms of like on a pay-per-use basis or sharing of the, when we say the gains that you make in terms of productivity, how can that be distributed between 2 or 3 partners in the deal, is something that we really need to look at and come up with some innovations around the commercial model. Technical innovation alone is not going to be sufficient. We need commercial innovation as well.
Right. I think that's a very, very important point, Ravi. And I can sense your, at least the baby warmer thing could have been avoided had the quality been adhered to. But Rishi, you brought up challenges right in the beginning, and you said, I'll come to the challenges later. So I was very intrigued as to what are your... you started off by telling me the positive, then you said, I'll come to the challenges. So what are those that you're saying?
We have been trying to launch many of the services, okay. In India and many other parts of the world, the regulatory requirements are still not clear, okay. So if I am wearing a device of a particular company and I'm using a connectivity of a particular service provider, and somebody else is monitoring me and some doctor is supposed to see me, and if I get a heart attack, whom will I go and legally battle with? And these are kind of challenges that are still not very clear. So who will take the ownership? Who will start as a front end? So first is on this, the regulatory and the policy requirement. When we say connectivity is a very important part, and the interoperability and the proper connectivity availability, coming from Delhi and coming to Bangalore, whether my Fitbit device or whatever I'm wearing will work in the same way or not. Whether the operator in Delhi is the same, has some kind of tie-ups with the operators in Bangalore. I'm talking about the big cities, okay? And then we are talking about decentralization and going to villages and other places where there is no connectivity. So, those are the kind of the second challenge. And, the security. Recently, I'm not sure how many of you have gone through a particular case study where a hacker got into a hospital and changed the configuration of a device. So the blood pressure monitor, which was supposed to give at 150 as an alarm, was not giving alarm even at 180. Okay. So we are still not secured networks. We are still, working on many things. And finally, I like to share one of the examples which I have been sharing in many forums. We did an experiment with a group of people wearing a device. Okay. So I was talking to Arvind, and we realized that if I go to getting my blood pressure checked, okay, my blood pressure will be slightly higher because I'm seeing that somebody is checking me. Okay, so the anxiety level increases. And imagine you are wearing a 24/7 device, and somebody else is monitoring you from the back. So the mindset was very, Ravi also mentioned this, Dr. Arvind also mentioned this. But the number of calls coming to the doctor in the night by the old people, am I okay? Is my data still coming? Okay. Well, much more than when they used to get earlier. So first, we are getting into a cultural change. We talk about decentralization, we talk about new technologies, but it's a cultural change that we are expecting. I am being monitored for my health every time. Okay, and that's a very big change. And honestly, the number of calls that the doctor used to receive got much more, and that too in the night. Before I go to sleep, I call a doctor and said, "Did you see my data? Am I okay?" So, okay, and but it's human. It's human.
I laugh because I can imagine some people in my family doing that.
Yeah, no. So my granny and my dad will do that. So it's a human nature.
And that's a very important point.
Yeah.
And one of my biggest frustration with wearables, especially, is the sync. You go from here to there, it doesn't sync. Then I waste and get frustrated, spend a lot of time. But Ashwin, coming to you, I mean, I have no doubt in my mind you're the closest to ground zero. So what are some of the things you are seeing as far as decentralization? Considering you want to remove hospitals in the next 25 years.
I think maybe it's working, yeah. So, in addition to being part of Vatsalya, I also work with a lot of startups as advisor or whatever. So I think because there are a lot of startups, I'll bring this towards the startup side of challenge. I think the single biggest challenge I see is not that we are not dreaming big enough. We are not being bold enough. I am tired of seeing ECG machines. New startups with new ways of making ECG, I think let's get over it, right? I think we have so many big problems. We are not addressing those, and clearly innovation is not going to come from from Philips type of companies. I mean, they will make things better, but startups have to come with really radical ideas, right? For example, diagnostics industry. We are still mixing things in the lab and putting it in a machine, right? We are in the age of genomics. There are so many opportunities there to decentralize, make it more affordable, make it automated, and things like that. There are opportunities to really radically rethink ICUs. Right? Imagine if you go to an ICU, there will be some 100 equipments there, right? Beeping, blapping. Who is looking at them? Have you ever wondered who is looking at these things? It's only to create anxiety for the patient. Right? The doctor, when he comes once or twice a day, will see the readings, most likely see the reports run by nurses. So this is a radical opportunity to say we don't need anything, just put sensors there, we'll monitor somewhere else, like what he said about tele-ICU. So I think my big challenge is, I think we are not, maybe it's a capital constraint, maybe it's the regulatory challenges, etc. But one principle I had when we started Vatsalya was we will never complain about the government not doing its job. Because if they did the job, we will not be in business. I think for medical startups, I think you should stop complaining about regulatory. If they did their job, you will not be in business.
I think, Ashwin, I think that's a good point. I must say that you're punching and hitting where it hurts. As a doctor, I can say that. But Ritesh, similar things or anything different? Or do you want to kick us this time?
So I think there are several challenges to moving this side. I'll not repeat what some of the other panelists have said. One challenge that we face in our portfolio companies constantly is process adherence. The three most dangerous words in the world of healthcare are, but I thought. You can only decentralize when you can de-skill, right? And when you have the guy on the ground saying, but I thought it needs to be done this way, that's where problems start. So process adherence is very, very hard. I have not seen shortcuts to that. The only training doesn't work very well because there is so much attrition. So the only thing that we have seen work is process compliance through technology. In LifeCell, we have given all the paramedics an app, which literally has a checklist. Do this, next, when you've done it, check it. Go to the next point, check it. Go to the next point, check it. That's the only way we have seen process adherence. And even then, I would say the compliance is not as high as we would have liked it to be. The second challenge in my mind is technology adoption by doctors. So we have found that it is much easier to get a paramedic to adopt technology. It is much easier to get a technician to adopt technology. But doctors are very, very hard to persuade. I sincerely believe that the only reason EMR has not taken off in India or really globally is because doctors don't like to type. And it's a very small thing, but doctors don't know how to touch type. Many of us are engineers, and we learned how to touch type probably in college. And because most of our medical education is on pen and paper, doctors don't know how to type. And for a doctor, it is very important to look into the eyes of the patient while communicating with them. So they don't want to be looking at keyboards. That little thing it's just one example of how hard it is to get doctors to adopt technology. There are technology solutions, of course, possible. But I think that is one of the biggest hurdles in decentralization.
Ritesh, I anticipated your response. And I'm carrying a tablet. No pen and paper. But yeah, I agree with you. It's one of the challenges, and I think Arvind and Ravi, all of you know. But now, we talked about decentralization, why it's required. We talked about challenges, roadblocks, etc. But can digital really help is the question. And if it can help, how? And when I help, I don't want a very well-educated, healthy individual to track how many steps he took today. I mean, that's good, but that's not the discussion here. It's about decentralization. So, Rishi, sorry, I'm putting you on the spot again. What are you seeing? Can digital really help, like meaningfully?
No, definitely. First of all, I am the head of digital enterprise services business. If I'll say no, I'll lose my job. So, so I have to say yes. But, but the amount of, see, we started with, there are three ways. We are an enterprise. First of all, we must understand. We are an enterprise. We are a listed company. We work for revenue and profits. Okay. So we are not a CSR company. We are not a charity organization. And most of us here are not for a charity organization. Okay. So digitalization will help a consumer. There's no doubt about it. Okay. And we can give you n number of examples where there is a huge amount of support, huge amount of things anybody can get because of the digitalization. We created an app which will be able to get you whether you are suffering from glaucoma or not. Okay. So technology can, you have a mobile and you have a mobile camera and you can see it, and the app will calculate and will be able to go to the positions and will be able to give you whether you will be suffering from glaucoma or not. Okay. But how much cost effective it is for me, whether I am going to get revenue out of it or not, whether it's going to be a billion-dollar idea, that's a big challenge. So digitalization is definitely going to support. There is no doubt about it. We have been able to reduce the number of patients going to the hospital. We have been able to save lives. We have been able to send the details of a ECG while tracking a patient to the hospital, so that, if 30 minutes, I was reading one of the articles and they said if 30 minutes before time I can provide support to a patient, I'll be able to save 10% of lives. Okay. And digitalization is what? Taking the care faster and reaching it faster. So if I'll be able to do this, we'll be able to save it. But the challenge, again, I'm talking about challenge, Vikram, is whether return on investment is there or not. We are not a charity organizations. We work for our revenues and profits, and our share price increase and decrease because of what we make as money. So, that's the bigger challenge, to create and develop a return on investment out of it. Yeah.
All right, good point, Rishi. And you carefully dodged the essential ROI question, but you put Arvind in a spot now, who I'm going to next. Arvind, is digital really helping you from a decentralization perspective?
I have no problem answering an ROI question because I'm the CIO, I'm not the CFO. So I ask for money. So I'm used to it. Digital will help because we are using this technology to simplify. If we are simplifying, that means we are bringing healthcare to more people. If we are bringing healthcare to more people, those who did not have healthcare will get healthcare. That means they will pay for it. So the ROI will happen not by increasing cost, but by increasing the breadth. Wow. Walmart model. So that's how, yes, I agree with him. This is about having the economy of healthcare being provided. So make it more accessible and simplify it. The more we simplify it, the better will be our speed to diagnosis. That means we'll get the facts straight. And we will get the longevity of a health record. And that's very important. Because all our health issues are connected to various events that have happened in our lives. And using technology means you'll get to it faster. Many a times we may not be able to remember it. And God forbid if we had to access my health record when I was knocked down. So that means that it makes it easier, speed to diagnosis, more availability. You increase the number of people, you touch 1 billion lives, your numbers will go.
Brilliant. I think you summed it up pretty well. And I love the fact that you are a CIO, not a CFO. That means
he doesn't like me.
We don't have to talk about CAGR and stuff like that. But coming back to the ground zero with Ashwin, do you see digital really helping, at least at the grassroots level? And if yes, then do you think it's a question of, not innovation, you said it's a question of breaking the barriers, or how's that working for you?
I think digital is really, in my mind, about empowerment, right? I think if we think about it from that perspective, the transfer of power from the institution to individuals will happen only if we use digital tools. So I think that's clearly an opportunity. But let me come back to the financial side of it, because I think that's very important, commercial side of. So in India, if you look at healthcare, right, healthcare is the second largest employer of people, third fastest growing category in India. And globally, it's a huge investment, right? If you look at US, probably spends, whatever, I don't know the numbers, it must be in some crazy gazillion number, right? But 25% of your 25% of an employer's cost, right, is health. So when Ford Motor Company was in trouble, they had this big piece, right? Healthcare cost of employees was unviable for them. So there's a significant opportunity. We have some colleagues working in South America. They're budgeting 26, 27% as overheads for health expenses for employees. And that's only increasing. So if you have such a big opportunity, and I agree with both Arvind and Rishi, is that the challenge is really to find ways to monetize that in a smart way. And I think more of the same, a little bit tweak of the same is not going to help. And in our own experience in running hospitals in small towns, I think it's incredibly important for us to leverage technology, digital tools, etc., but also use that as a fundamental piece of expanding our business. It allows us to rethink our own model, question assumptions, and then move on.
Thank you, Ashwin. No doubt in my mind, Vatsalya is doing a great service, as a business, but still providing great social service. That's where healthcare, interestingly, falls in most private entities. So, Ritesh, coming to you, are you seeing? I mean, I've heard of your examples. I've read through some of your startups as well. Do you really see digital making that difference, or do you see it's there, and guess what? Every industry is going digital, so should healthcare. Is it digital for the sake of digital, or is it really helping your startups?
No, I think there is no healthcare today without technology. So a lot of people ask us, do you invest in healthcare or do you invest in health tech? And I think of that as a question that that doesn't mean anything, because today you cannot scale healthcare without technology. Maybe I can give you some examples to demonstrate that. So the three companies I have talked about so far, IQ, LifeCell, Tenties, they are all traditional companies providing real healthcare. Yet, today for LifeCell, about 50% of their business comes online. That means the customer is acquired online, the customer purchases online, and the customer is scheduled for the actual pickup of the sample online. The only part that is offline is when the phlebotomist goes, and that phlebotomist uses its app, their app, as I mentioned earlier. The only offline part of that process is picking up the sample. After that, it's back to digital. There is a third-party logistics provider. They track the sample, comes to the lab, the customer gets real-time reports. Any of you LifeCell customers here? You would have noticed. Thank you for your business, first of all. You would have noticed that when your sample reaches the logistics provider, you get a notification. When it reaches the lab, you get a notification. When it is processed, you get a notification. So all aspects of this entire process, right from signing up as a customer or even as an interested potential customer to your final report getting generated, this entire process is completely online today. And you cannot impediment to an accurate diagnosis is the skill of the radiologist who looks at the ultrasound and gives and takes some measurements. And that is a problem you can only solve. You cannot go and upskill 20,000 radiologists across the country. Right? The only way to solve that problem is to centralize a team of highly trained radiologists who are specialized in doing this, and empower the local radiologist with technology to be able to communicate that image back to the central point. So that is otherwise diseases will remain undetected and causing a lot of pain to the child and the parent.
So really, really good example, Ritesh, and I can totally empathize being a father. That, especially for prenatal checkups, I think that's very, very important. So Ravi, coming to you finally, I know you're a big proponent of digital, but alluding to our discussion earlier, is that helping you help others?
Absolutely, in the sense that the panelists have alluded to the need of it. For sure, there is a need for decentralization. The volume, the financial viability is going to come from the volumes that you are going to hit out. And therefore,